All right, welcome to the Monkeypox Town Hall hosted by Wyoming Equality and the Wyoming Department of Health. As we navigate recent outbreaks throughout the country, we want to make sure that our state is also aware. So Wyoming Equality is partnering as part of their Wyoming Equality Health Access Project. And this project basically intends to make sure that LGBTQ individuals are receiving adequate healthcare throughout the state of Wyoming, and also educating themselves on conditions such as monkeypox, STIs, and COVID-19. So without further ado, I'm going to have Allie Harris from Wyoming Department of Health take it away.
Well, thanks, Coda, and good evening, everybody. It's great to be here. Thanks to Coda and everyone at Wyoming Equality for working with us to make this happen. And hopefully today I can provide some useful information about the current monkeypox or MPX outbreak in the United States and how we can protect ourselves from infection. I'm Allie Harris, and I'm the State Health Officer at the Wyoming Department of Health. What I hope to cover today are what is the MPX virus and where did it come from? What does the current MPX outbreak look like in the United States and Wyoming? How MPX is spread and what the symptoms look like? How we can get tested for MPX? And spend a lot of time on how to prevent MPX infection through vaccination and preventing of exposure. And then finally, I'll close it out with, what should we do if we know we've been exposed to MPX or have been diagnosed with MPX? So starting with what is MPX? It's actually not a new virus. We've known about it since 1958 when it was identified in primates in Africa. And the first human infection was in 1970. The virus is related to the virus that causes smallpox, but is thankfully much less severe. And until the spring of this year, human infections were relatively rare, and they were usually in either Central or Western Africa in the countries I'm showing here, related to animal exposure or known exposure to someone else who was infected with monkeypox. It did rarely occur in countries outside of Africa, but again, it was usually known to be direct exposure to animal products or to another person who was diagnosed with monkeypox. But starting in this spring, countries outside of Africa started to report that individuals were being diagnosed with MPX who didn't have any exposure to animals or travel to Africa or known contact with somebody else with MPX. And unfortunately, those numbers of infections continued to rise and spread to other countries, including the United States. And as of today, we've had over 27,000 individuals diagnosed with MPX in the United States, as shown in this map, as well as 4 cases for individuals diagnosed here in Wyoming. Good news is that it looks like the number of infections is coming down over the past couple of months. So you can see there's time on the x-axis and the number of individuals diagnosed per day on the y-axis in the United States. And we saw a pretty dramatic increase starting around June. But since the middle of August, the number of cases per day has been decreasing and the number of individuals being diagnosed with MPX decreasing, which is a good thing. And there's probably a number of reasons for that. One being that increasing access to the vaccine, as well as individuals taking steps to prevent their exposure. And we certainly hope this trend continues, but we are continuing to see MPX being diagnosed here in the US. It's important for us to look at the demographic characteristics of people who have been diagnosed with MPX to understand who is most at risk of infection in this outbreak. So you can see here, we see the ages of people who have been diagnosed on the x-axis, and then again, the number of cases on the y-axis, and then the colors represent how people identify in terms of their gender. And you can see that the vast majority of cases of infections have been among cisgender males, adult males. And looking even further into the data, it's clear that most infections in the United States have been among individuals who identify as men who have sex with men, indicating that that group is at one of the highest risks of infection during this outbreak. And just to again go over what we've seen in Wyoming, 4 Wyoming residents have been diagnosed with monkeypox. Consistent with what's happening in the country, all have been adult males. There's been no further spread from these 4 individuals, and these individuals were from Teton, Campbell, Natrona, and Laramie counties. So how is MPX spread from person to person? MPX can spread to anybody, primarily through close and often skin-to-skin contact. So this can include direct contact from one person's skin to another person's rash, including the scabs or body fluids from someone who's been diagnosed with monkeypox, touching objects such as clothing or bedding or surfaces that have been used by somebody with monkeypox, or contact with respiratory secretions such as saliva. It is important to note that monkeypox is not as easily spread through the respiratory route as, for example, COVID-19 is. It takes really prolonged face-to-face contact or intimate contact, like kissing or sharing utensils, to spread monkeypox through the respiratory route, but it can be spread that way. What we're seeing during this outbreak is that this direct contact is often happening during intimate contact, including sexual activities, prolonged intimate activities like hugging, massage, or kissing, as I mentioned before, prolonged face-to-face contact, as well as contact with objects or fabrics during sex that have been used by a person with monkeypox. So things like bedding, towels, sex toys, etc. The main symptom of monkeypox is a rash. And this rash can, we've seen during this outbreak, look different for different people, which sometimes can make it be hard to identify. So the rash can initially be flat, so sort of red or different colored patches on the skin, or it can look initially like pimples or blisters. Characteristically of monkeypox, though, the rash progresses through several stages, including pustules, so sort of bumps with pus inside on the skin, which eventually turn into scabs. The rash can be limited to really one area of the body or spread over a large part of the body. And in this outbreak, we're seeing that many individuals have rash in the genital or anal region because their exposure was through intimate sexual contact. It's also important to note that lesions can occur in the mouth or anus and might not be visible to the person, but they can cause symptoms such as pain and can spread the virus to others. People can have as few as one lesion, or they can have many. The rash is unfortunately often painful, especially initially, and then as it progresses, it becomes pretty itchy. So shown here are some pictures of what the rash of MPX can look like. On the second from the left to the top and on the bottom right are maybe an earlier type of rash where you have a bump or like a pimple or a blister. And then a lot of the other pictures show what the pustules look like. So the big white bumps that have pus inside, these are usually pretty firm to the touch. And people can have different stages of the rash, in the same area. So that's shown in the picture of the person's back, where you can see the rash looks a little bit different, each different lesion. I've linked here to a website from CDC that has a lot of pictures of the rash, so you can see even more if that is helpful. It's also important to remember that a lot of things can cause rash, and a lot of rashes can look alike. So other infections can cause rash, contact with things that irritate the skin can cause rash. And so it's helpful to talk to a healthcare provider, have them look at the rash, look at your potential risk factors for different types of rashes and base testing decisions based on that. It's often appropriate for a person to be tested for a couple of things at once, such as if there is a rash in the genital area, to also be tested for syphilis. Along with the rash, people with MPX infection can experience what we call systemic or flu-like symptoms like fever and chills, swollen lymph nodes, extreme tiredness, aches in muscles, the back and the head, and respiratory symptoms like a sore throat and a cough. These aren't consistent though in people who are diagnosed with monkeypox. Sometimes the people have flu-like symptoms before the rash, and sometimes they actually come after the rash. And some people only get the rash. But it's important to note these symptoms. These, of course, can be symptoms of other infections like COVID-19 and flu, but always good to talk to your healthcare provider if you're experiencing these symptoms. So people who get sick with this virus usually start to see symptoms within 3 weeks of exposure. It can be as early as 7 days, as 3 days, but take up to 3 weeks. If flu-like symptoms develop first, the rash is usually going to appear about 1 to 4 days later. The rash progresses, as we talked about before. Eventually scabs form, which fall off, and a new layer of skin develops underneath. And this whole course can last a fairly long time for an illness, 2 to 4 weeks. People can spread MPX to others from the time they get any symptoms, so whether that's the rash first or the fever first, and can continue to spread it until the rash has healed, all scabs have fallen off, and a fresh layer of skin has formed. Thankfully, during this outbreak, most individuals have had relatively mild illness, but it is important to know that severe illness can occur, especially in people whose immune system is impacted by other conditions, such as HIV that's not adequately treated, or medications that impact the immune system. So we certainly do recommend that anyone who does test positive for MPX also be tested for HIV, so that can be treated as well. How can we be tested for MPX? So it is important to know that testing can only be done once a rash develops. So we don't at this time have a way to test people who have been exposed but don't yet have symptoms, or to test people who just have the systemic symptoms like fever but don't yet have a rash. And we also don't have any at-home testing at this point. So testing can only be done by a healthcare provider. The healthcare provider essentially just swabs one or even preferably multiple lesions of the rash. And then there's also no rapid testing, so the swabs are sent to a laboratory, so it usually takes several days to get results. So what I'll spend the bulk of the time on is how can we prevent ourselves from getting MPX infection. And one of the tools we have is vaccination. I'll talk in a little bit more detail on the next slide, but pre-exposure vaccination, or vaccination before a known exposure to MPX, is available for the groups of individuals that are at highest risk of infection during this outbreak. Post-exposure vaccination, so vaccination to prevent infection when you've been exposed, is also available for individuals who have been exposed within the past 14 days. The vaccine that we use is called Jynneos. It was developed before this outbreak. It was first approved in 2019 for prevention of both MPX and smallpox. We need 2 doses spaced 28 days apart in order to have full protection. And because of limited supplies nationally at this time, it is currently only available at public health nursing offices, but we certainly hope that in the near future that expands to other locations like pharmacies and clinics. So the groups that are most at risk for MPX infection at this time are eligible for what we call pre-exposure vaccination. This includes men who have sex with men, including anyone who identifies as a man regardless of designated sex at birth, who in the past year have had either a new diagnosis of a sexually transmitted infection, or in the past year have had anonymous or multiple sex partners. It also includes people who in the past year have either had sex at a commercial sex venue or sex in association with a large public event in an area where MPX is spreading. It also includes sex workers of any sex, sexual partners of people with the above risks, and people who anticipate experiencing the above risks. And this is all on our website. And we do update it periodically. So encourage people to go look at the website and see if they are eligible. If I know that I have had close contact or had exposure to MPX, I am recommended to get a post-exposure vaccination to help prevent infection. So this would include individuals with sexual contact or other close contact, such as being a household contact with another individual known or suspected to have MPX, or individuals who had close contact in the past 2 weeks with others at some type of an event where a suspected or confirmed MPX outbreak was occurring. Post-exposure vaccination is most effective within 4 days of exposure to prevent infection. But vaccination within 5 to 14 days may help lessen the severity of symptoms and the duration of symptoms. So we do recommend seeking post-exposure vaccination for up to those 14 days. And it's also important to note that if you fit into one of the pre-exposure categories, you can get vaccinated even if it's been longer than 14 days. Unfortunately, once someone develops symptoms, vaccination is no longer thought to provide any benefit. So it is really important to seek vaccination as soon as possible after you know about an exposure. So how is the vaccination done? So most vaccines right now are being administered using intradermal dosing, which is shown in the picture on the right. So essentially, it's a small needle that goes into the skin and often forms the little bubble under the skin that you can see there. Anybody who's had a PPD as a test for tuberculosis will be familiar with this. It's the exact same process. There are some people with certain skin conditions, such as keloidosis, where the skin has a reaction to this type of injection that should be vaccinated in a different way in the upper arm. And when you go to get vaccinated, the person who is vaccinating you will ask about these types of conditions. It's important to note that we're not considered fully immune and to have full protection until 14 days after the second dose. So we're still at risk between the first and second doses and for a couple weeks after that second dose. And that's a total time period of 6 weeks after that first dose. We like to let patients know and people know when they get the vaccine that there are expected side effects that we expect and are really a sign that the immune system is responding appropriately. And so they're not alarmed when they see these symptoms. So at the site of the injection, people often experience redness, pain, swelling, itching, and discoloration of the skin. This can last for weeks or even months, but is expected to, resolve over time. And then, like with any vaccine, people can experience systemic symptoms like tiredness and headache, muscle aches, nausea, chills, and fever. Again, all signs that the immune system is responding to the vaccine and producing the antibodies. Along with vaccination, there are strategies that we can take to avoid being exposed to MPX. We certainly always recommend talking with your partner about any MPX symptoms, such as a rash, and either avoiding intimate contact or avoiding contact with the rash during intimate activities. People can consider taking a temporary break from activities that increase exposure to monkeypox until you've been fully vaccinated. Can also consider limiting our number of sex partners to reduce the likelihood that we're exposed. We've seen in this outbreak that spaces like sex clubs or sex parties where intimate contact is occurring with either multiple or anonymous partners are more likely to spread MPX. And so people can consider reducing their participation in these activities. We also like to let people know that condoms alone may not prevent all exposures to monkeypox because rash can occur on multiple parts of the body. We, of course, continue to encourage condoms because they are highly effective at preventing transmission of sexually transmitted infections, but want to let people know that they may not be enough to protect against MPX exposure during sex. As I mentioned before, MPX along with skin-to-skin contact can be spread through respiratory secretions if there's close, prolonged face-to-face contact. And so people can consider other ways to avoid skin-to-skin contact during intimate activities, such as wearing additional clothing or doing virtual activities. And always remember to wash hands, fetish gear, sex toys, any bedding or towels after having sex to help prevent infection. So to sort of close it all up, what should I do if I know I was exposed to MPX? And people might know this in a couple ways. One, because we were informed by a partner or another close contact, such as a roommate, that they were diagnosed with MPX. Or people might get a call from the Wyoming Department of Health. With MPX, like with a lot of other types of infections, we do contact people who are diagnosed with MPX and ask them about their symptoms and about their exposures, and also ask about people that might have been exposed through close contact. And so we might know that you've been exposed that way, then we would contact you and let you know and help walk through the appropriate next steps. What we'll recommend is that if your exposure was within the past 14 days and you don't have any symptoms, we'd recommend getting post-exposure vaccination, recommend that you contact your local public health nursing office to schedule that appointment as soon as possible. And then watch for symptoms. If you don't have symptoms, there's no need to stay home or change your activities. But if you do develop symptoms, we would ask you to stay home if at all possible, except of course to seek medical care and avoid close contact with others that could spread MPX. We also recommend you contact your healthcare provider for evaluation of your symptoms and possible testing for MPX if that's what's appropriate. If you are tested for MPX, we'd ask you to stay home until you've received your test results, again, to help prevent MPX from spreading further. If I test positive for MPX, we'd recommend that people continue to stay home, again, except of course to seek medical care, and avoid close contact with other people and also with pets, because we do know that animals can get MPX and that there has been a couple of pets known to have gotten MPX during this outbreak. We'd recommend that you ask your healthcare provider about available medications and treatments. As I mentioned, the rash can be painful and itchy, and people can have symptoms such as fever, muscle aches, which are very uncomfortable. There are medications available to treat these symptoms and help people feel better. There are also some medications that are available to actually fight the virus itself. TPOXX is one of those. It is available in Wyoming. All of these medications, however, are under what is called an investigational new drug protocol. So they're being studied right now to see how effective they are against MPX. So there is some additional paperwork, and the provider will need to explain very closely the risks and benefits of the medication to you. But initial data coming from the country right now shows that TPOXX may be effective in helping reduce the severity of symptoms and the duration of symptoms. So want to let people know about that is available in Wyoming if it's appropriate for you based on what you and your provider decide. We'd ask that you let your provider know right away about any severe symptoms. So any symptoms in the eye, any difficulty breathing, any difficulty eating or drinking or using the bathroom could be a sign of a more severe illness. And it's important that you be assessed as soon as possible. And then, as I mentioned before, expect a call from us. We'll ask about your symptoms and exposures, especially in a new outbreak like this. It helps us to better understand what these MPX infections are looking like and how people are getting exposed. So we can understand better how to prevent it and also communicate to people what the infection looks like and how they can protect themselves. And we will ask about any close contacts that you might have had while sick so that we can notify them and they can take the appropriate actions. We never, unless we have your permission, tell the close contacts who they've been exposed to. We just let them know that they have been exposed. And you'll have us on the phone so we can help answer your questions about MPX, and you'll have our contact information in case questions come up later on. And as I mentioned before, just be aware that it may take 2 to 4 weeks for recovery. It can feel like a really long time, but just so that everyone knows to expect that. And I did include on the bottom a link to where all our public health nursing offices are and their contact information so that people can reach out to ask about vaccination. And that's all I had for tonight. I want to thank again Wyoming Equality for being here and my team at the Department of Health. And I will conclude.
All right, as we move into questions, I have a couple of ones that have just been asked or widely speculated on online by people who are directly impacted. So first, for people who received a smallpox vaccination in the early 70s and late 60s, do they still need to get a vaccination if they are still in a category impacted by monkeypox?
Yeah, that is a great question. And for people who have received smallpox vaccine, that long ago, and they are at a higher risk for infection, we would recommend that they now get the MPX vaccine. Usually those boosters need to be given to remain effective. And so certainly people who have been vaccinated that long ago, we would recommend they get the full series of MPX vaccine.
All right, and then many people are worried about common places where other illnesses might be an issue, such as tattoo parlors, piercing studios, just because of the shared objects that oftentimes touch blood. Do people need to worry about tattoo shops, piercing parlors, and things along those lines, as long as necessary cleaning procedures are happening?
Yeah, that's the key, is to make sure that, the business that you're using is following those cleaning procedures. Certainly because shared contact is a way that MPX can be spread. If those cleaning procedures, weren't performed, such as in an unprofessional setting, certainly that could be a risk for MPX, as well as the spread of other bloodborne infections. And so definitely ensuring that the business that you're using is following those procedures is the best strategy, and the procedures they use, are adequate to prevent MPX spread.
And then can you go over some myths about MPX transmission that you've seen and kind of explain why those are false?
Yeah, that is a great question. I think people are coming off of the COVID pandemic, as I mentioned before. I think people are worried that it spreads in the same way, and it certainly doesn't. It really does take that close, intimate skin to skin or prolonged face to face contact. So this isn't something, riding public transportation or going to the grocery store or the mall, something that people have to be worried about MPX infection. I think another myth is that, or, another important point to make is really anybody can get MPX. All it takes is that skin to skin contact. And so, just understanding how MPX is spread, I think, is important. But I'd be happy to hear any myths that you've heard and respond to them if there are any.
I mostly asked it with the tattoo one, but with the next question, how can people kind of find a way to stay as up to date on vaccines as they can while they become more widely available to the public with new supply?
For specifically the MPX vaccine?
Yes.
Yeah, I think as soon as possible, reach out to your public health nursing office. And, we're at a point with the MPX supply where we don't have to put off second doses. We have enough to be scheduling second doses. So get that second dose scheduled, 28 days after the first dose. And having that scheduled and a time to go in and everything should be the best way to make sure that you stay up to date. It's always good to check on our website to look at eligibility criteria and for information about where the vaccine is available. We'll make sure to post for COVID-19, for example. There were websites that the federal government put out that showed the pharmacies, et cetera, that were getting the vaccines. And so hopefully there will be something similar for MPX vaccine, and we'll make sure to have that available on our website so people can check where it's available.
All right. And then on the topic of COVID, should people who recently got a new COVID booster take any extra precautions before getting an MPX vaccine?
Oh, that is a great question. If you have been, I actually might have to get back to you on this one because it sort of goes both ways. So if it's okay, I can send you an email, Coda, with that information. There are some precautions that particularly younger males might consider taking in terms of spacing out the vaccines. because of the increased risk of myocarditis in that age group that we've seen with the COVID-19 vaccine. So I can get those specific recommendations to you.
Thank you. And then that's all of the questions that I had prepared. But if anyone is curious about it, feel free to reach out to your local Wyoming Department of Health public nursing offices and ask those questions. Nurses are available to answer them for that exact reason. Once again, I want to thank the Wyoming Department of Health and the CDU for partnering with Wyoming Equality today and making sure that our community's questions about the MPX outbreaks get answered.
Thank you.
Thank you, Coda.
Thank you.
Thanks, everyone.